Hello everyone, how's it going? My name is Ali, I'm an F1 working at Addenbrooke's at the moment, and in this video, me and a few current students are going to be talking about what to expect from your upcoming GP placements and how you can make the most of them. So let's just start with a quick overview, and as you might already know, basically on GP placement, you and a few friends are going to be chucked out to a GP practice somewhere in the region. Now this might be close to Cambridge, or it might be miles away in the middle of nowhere. And then each day when you go in, you're ultimately working towards being able to run your own consultations. So right at the start, you're probably going to be sitting in with a GP a fair bit, watching them do consultations, but also occasionally doing histories and examinations yourself, just to kind of ease you into the whole GP life thing. But very quickly, as you get more experienced, you're going to be running your own consultations. And the idea behind that is that you basically call the patient in, you take the history, do the examination, like pretty much work out what's wrong with them and what you can do about it. And then once you've done that, once you've got a plan of action, you'd call the GP in, and then they would listen to you presenting the patient, listen to your plan, and decide whether they agree with you and just kind of put their signature on the prescription, or if they disagree with you and why they disagree and what they would do instead. So as you can probably guess, this is actually a really good learning experience in terms of how to actually be a doctor, how to see a patient as they come in through the door and sort them out. And here are Izzy and Yuhan elaborating on why GP offers such a unique opportunity.
One of the best things about being on GP is that you're getting to see patients when they first present to medical care. So taking histories from them is much more interesting because they're not telling you what's wrong with them, which is really good fun. And you get much more opportunity to kind of talk to them about their worries and concerns as well, because they're very real when they're first presenting. And it's also a lot more like what your exams might be like, taking a history when you actually have no idea what's wrong with them.
This is quite different to being in a hospital, because when you're on the wards, often when you examine patients, they already know what their diagnosis is, and they might have come in days to weeks ago. You kind of have to go up to them and ask, as if you didn't know your diagnosis, can you tell me what happened like 4 weeks ago? And they might not remember how they presented.
All right, so we've heard about how GP gives you very realistic practice of what being a doctor is actually like. Let's now talk a little bit about how to make the most of your GP placements. And the very first thing to say on this is that you really do get out what you put into it. So the more effort you put into actively engaging and actively asking questions and actively trying to learn, the better you'll find the whole experience overall. Secondly, the GP placements are a really good way of understanding how healthcare actually works in the community. You're going to be spending loads of time with the GP and running your own consultations and all of that stuff, but you also might have the chance to spend an afternoon with a district nurse or the GP pharmacy, or go on home visits or visit the local nursing home or residential home. And all of these various experiences really help you in understanding how healthcare in the community works, especially for elderly people. And in a few years' time, when you're the F1 writing the discharge letter for Mr. Joe Bloggs, the 86-year-old gentleman, who needs to have his dressing changed by the district nurse, and it needs follow up with his GP, for his anticoagulation, and needs this dispense from the pharmacy, you're really going to look back at that time on GP placement, and you're going to be glad that you had all these various experiences that you can now understand what all of this stuff actually means. At this point, it's really important to say that while most GP practices will organize these various experiences for you and have like a pretty good timetable for you to make the most out of it, you do kind of have to be in charge of your own learning to an extent, and you do have to use your initiative a little bit.
The main difference with clinical medicine compared to like pre-clinical medicine or like having lectures is that you really have to be proactive to get the most out of it.
It's really, really important when you are on any placement actually, but especially on GP, to ask for things. Like if you're not getting time with patients, if you're not getting time where doctors are like taking the time to teach you or whatever, make sure you ask, because that has to be your first port of call, because they might not realise that that's what you want, especially if they're perhaps the practice that hasn't taken as many students before.
So yeah, hopefully when you rock up to GP for the first time, they'll give you this beautifully organised timetable and everything is going to run like clockwork. But just in case it doesn't, because this is real life and stuff gets in the way and emergencies happen, just in case you find that you've missed a teaching session or two, or you're not getting as many consultations as you'd like, just talk to the GP about it. Like, they all want to give you a good experience. They want you to learn a lot from it. And the first thing you have to do has to be to ask and to speak up for yourself. Let's now talk about how to make the most of your GP placements if you happen to be placed in the middle of nowhere. And here are Summer and Alice talking about their own experiences of being miles away from civilization.
So my GP was sort of out in the sticks of it. I was a bit apprehensive about being in the middle of nowhere, but actually it was a really positive experience. We got to know the locals quite well, and there would be a cute little high street, and we would go to the sandwich shop, and the lady in the sandwich shop got to know us, and it was just a really nice little atmosphere in a little village where you would sometimes see patients that you'd seen before and things as well.
So Munderley was super cute, just a really lovely village, and you got to see quite a lot of elderly patients as well as patients with learning disabilities, because that's kind of what the area caters for. And it was really nice going around with the GPs and their little cars along the Norfolk coast paths. So yeah, it's a really kind of different set of patients with a different set of demographics. So definitely a really good opportunity.
Being out in the middle of nowhere is actually quite an adventurous kind of thing to do, and especially if you're with a buddy, you could just easily take the opportunity to just go and explore the area. And yeah, I think you should take it as a good time off from the intense atmosphere of when you're at clinical school.
So yeah, if you do get placed in the middle of nowhere, don't think of it as being a bad thing. Like, I was absolutely miles away from Cambridge for all 3 of my placements in years 4, 5, and 6. But actually I found that GP was probably the most enjoyable part of clinical school. Me and the people I was with, we were all determined to make it into a good experience rather than to complain about it. And so we ended up doing loads of exploring and just had a really good time overall and ended up becoming quite good friends. So those were some of our tips on how you can make the most of your GP placements. Let's now end this video by hearing from Izzy, who's going to be talking about why she just absolutely loves GP placements.
So I absolutely love GP placement. It's always been really good fun just because of the variety of stuff. Like, there isn't really anywhere else where you can go from seeing like a 6-week-old baby to someone who's 90 and has multiple comorbidities in the space of half an hour. And it is just really good fun. And often GPs are really friendly, really chatty people who are really interested in building relationships with their patient. And they can be just really good people to have a chat with in a coffee break. I've met some really, really interesting people and actually found a couple of really great mentors amongst the GPs who I've sat in with. They've given me really good advice about work-life balance or about the specialties they were involved with before GP, all those kinds of things. There's so much to gain from it, and that's one of the best things about GP, is that you can learn about almost anything. And it just is really, really good fun.
So yeah, as we've heard, GP is genuinely really, really fun, and it's a pretty great learning experience as well. And that brings us to the end of the video. Hopefully you found it useful. We've talked a little bit about what to expect from GP placements and also shared a few pointers about how you can make the most of them. So that's it from us. We hope you have a great time on your GP placements and in the rest of clinical school, because it's pretty awesome. Now it's time to hand back over to the adults in the room. So thanks for watching and have a great time. Goodbye.